Hi, my name is Jessica Leonard and this is David Leonard. Today I'm going to be doing deep tendon reflex skills video for my nursing course at Nightingale College. It's going to be assessed by instructors, faculty, and accreditors, and I am obtaining consent from David to be a participant and to be recorded. David, do you consent to be recorded and to participate?
Yes, I consent to participating and being recorded.
Okay, great, thank you. So I'm gonna start by entering the patient's room, close the curtain or door behind me. I'm gonna do hand hygiene, and I'm going to introduce myself and explain the procedure. Hi, David, I'm Jessica. I'm your nurse today. Let me just verify you with 2 patient identifiers. Let me get your full name and your date of birth.
David Leonard, 7/29/86.
I'm looking at his wristband and those do match up, so great, thank you. So I'm here today to do deep tendon reflex assessment on you. The reason I'm gonna do that is it assesses your motor system's response to stimulation, and that would let me know that your neurons, what level they're responding to that stimulation. And the way that we rate that response is a 0 to 4 scale. So 0 would be absent, 1 would be hypoactive or diminished, 2 is normal, 3 is hyperactive or brisk, and 4 is brisk with clonus. So this assessment can be done on anyone, but it's really important to do on a pregnant woman because a hyperactive response can indicate preeclampsia. I'm gonna do 4 tendons and assess for clonus. The tendon I'm gonna do here is the bicep. We're gonna do tricep, and we're gonna do patellar and Achilles. I'm gonna start by having you relax your arm. I'm gonna put my thumb near that bicep tendon. Everything's relaxed there. I'm gonna use the pointy side of my hammer. I'm gonna hit my thumb, and I did feel a reaction in the bicep, and I saw the fingers move. To do the tricep, we're going to have you relax your right-handed here. So have you relax your arm, and above the elbow kind of comes to a point here. I'm going to use the pointy side again and just hit right above the elbow here for that tricep tendon. And I saw a little reaction. He moved to the right there. Go ahead and relax. Bring your legs off of there you go, and just relax your leg. Okay, your patellar tendon is underneath the kneecap, and it kind of comes to a point here too. This time I'm going to be using the flat side of my hammer. I saw a very slight reaction there. His leg moved forward. For the Achilles tendon, it's on the back of the leg above the heel. You'll feel an indentation and kind of like a wiry tendon there. I'm going to use this hand to dorsiflex the foot, and I'm using the flat end of the hammer here. His foot went down, so that is a normal response. Done using the hammer, I'm going to dorsiflex the foot. This is me checking for clonus, and I'm gonna keep the foot here for a moment, and then when I let go of the foot, he goes right back to a relaxed position. That tells me he's negative for clonus. If he were positive for clonus, I'd see some shaking or trembling in the foot. 3 or 4 shakes there in the foot would indicate positive for clonus. And the reason that's important, a positive clonus means you're at risk for preeclampsia. I'm gonna go ahead and now make sure my patient's in a position of comfort. And I'm gonna do hand hygiene. I'm going to chart my assessment, and that is it. Thank you.